Right, we are right at the top of the hour. I will start, and as always, this is recorded. You are welcome to turn your camera off so I can see a face. I like that or not. Ask questions in the chat box. This will be recorded and it's posted on the two different Facebook groups, Marketplace Mastery and North American Life Insurance on their Facebook. Though you can certainly email me if you're like, hey, I can't find the one from 2 weeks ago. I'm happy to send those out to you. All right, so you may wonder why I have a picture of cake up here. If you saw what I wrote earlier, this is about layering, about protecting your clients. So we have a bunch of people who are going to be coming off of Medicaid who have been spoiled, for better or worse, it just is. They have had no payments out of their pocket. So the premiums have been really affordable, but so is the cost of using it, right? They go to the doctor and it doesn't cost them anything. They go to the hospital, they've had surgery, they've had babies, and they've had to pay nothing. And they're going to come off, and I'm just warning you right now, the people who are probably should have been paying, the 6 figures, they're going to ones who are going to complain the most. The little old lady who's living off Social Security and is 62 is going to be just thankful they can get insurance that's affordable. So just be aware, people get used to nice things, and when the nice thing is taken away, whether they deserved it or not, they will feel a little bit grumpy about it. So quick snapshot again, 91 million people are currently covered with Medicaid across the country. They're expecting 15 million to lose that. A good chunk of them are going to go on employers. 2.7 million is the estimate of how many people will qualify for tax credits, and they are guessing almost half of those will get that $0 premium. Now, how do they figure that out? I don't know. It's so different. Every state is different. Every county is different. And sometimes I think they push that zero premium plan a little too much. Zero does not necessarily mean good. So make sure you're doing your due diligence with people that they actually know. Just because it says zero doesn't mean that's the right one. So close that one. And if you have not sure what state you are, here's the state timelines. The first initiation of those letters going out is in the left column, the first term. So some of the states, April, these states have already started. Then we've got the few in May, June. Heck, we got Oregon doesn't even start kicking people off till October. So if it hasn't started really high in your area yet, that's okay. It's going to happen. This is going to be a snowball. If you look, the big chunk of them are actually in June. So they've gotten those letters. If you are aware how people work, a lot of last minute, right? Lots of last minute people. So I expect that the last week of the month is going to be very busy. They're going to try and go onto their Medicaid system. They're going to try and re-enroll or fill out the application again. And then they're going to find out 2-3 weeks before they find out, or maybe they're denied right away. And then they're going to be calling, desperately searching for somebody who can get them in right away. So kind of our plan at our office is to just keep that last week of the month open. If nothing crazy happens, no big deal. So here's the states, but it's going to be a trickle. It starts off with just a few, and it's just going to get bigger and bigger. And then again, check your state. Wisconsin is stretching it out the entire year. Texas is getting rid of them in 6 months. So every state is different. All right. So this is some of the other outreach ideas. I saw this on a Health Sherpa thing, and I thought I'm just going to share that really quick. That is, if you have Health Sherpa, you could be part of their things. The local businesses, I didn't even think about this, but community centers and food banks. I was like, oh, okay. And grocery stores, they almost all have poster things that you can put up, where you can put in a community thing. So go ahead and, look at your local businesses, just get posters. The poster that I created is going to be going live soon. And I can show you a picture out of it if you would like. But one of the things I found is if you go to FFM or CMS, they actually have a whole bunch of, I don't know if I'd call them pictures but they have some stuff that you can use. So I know if those of you who are used to Medicare are like, hey, what's the regulations? What's the regulations? And there really isn't regulations. The marketplace kind of just says, don't lie. So it's kind of a free for all out there. Unlike Medicare, where you're like, hey, Medicare is like, no, you need to tell me exactly, what you're doing and how you're doing it. And I hear now you can't use the word Medicare in your taglines. The marketplace isn't like that, but there is on FFM. They have options for you for pictures. I will actually send that out later in an email to everybody. I'm going to post that again in the Facebook pages. So you don't have to reinvent the wheel. You can use what somebody else has already created. These are the Medicaid unwinding and how they impact carriers. That's I thought was rather interesting. So see all of these, the ones that have Medicaid only, that means the carriers, some carriers do Medicaid and Marketplace, and some only do Marketplace and some only do Medicaid. So these plans that, where it says Medicaid only, so these states, a lot of these areas, they have to find a different carrier. So they're going to need your help to find out their network. If they're in both plans, Molina is one. Molina is often an ACA and it's on the marketplace. So if they're in Molina, they can stay with Molina and they're like, okay, at least I know this, I'm familiar. But there are a lot of ones that those carriers where they don't. So they're expecting it to be a pretty high volume. And then there's marketplace only plans, right? So that's the green counties where those carriers do not participate in the Medicaid system. So you're going to be getting a lot of those people going from a company they're familiar with to a company they've never heard of. Just kind of be aware of that. It's not really a big deal, but it's just something to be aware of. And one last thing on the Medicaid unwinding. So these are, again, assessment states, determination states, and unknown. So some states, you can do the whole Medicaid or marketplace enrollment in the same one. That's these determination states. It just does it for you. The assessment states, the marketplace is doing the assessment, but it's really every state in here's Medicaid system that will determine it. So if you're in one of the determination states, you're probably familiar with how that works. It's right there. These ones are unknown, partly because they're still doing it and they have state exchanges. But the assessment states is where the marketplace is making the assessment to transfer it to the state, but then the state is the one who makes the decision on whether somebody's Medicaid or Medicare or ACA eligible. All right, more people joining. All right, so cake. What we were mainly talking about today is layering and protecting your clients. And I know many of us feel like a used car salesman. Like if I start telling them too many things, they're going to think I'm just trying to service them for, I'm going to take them for everything they have. And that's not really true. Yes, you can. You can have that mentality. You can be that type of person that does that. But I don't think most people who are individual ACA marketplace people are doing that. We're trying to protect them. We want them to understand how the marketplace works. We want them to understand how the tax credit works. So protecting them is more than just giving them the right plan. I'm going to pull up, make sure that I got more people signing in. I'm going to pull up My Health Sherpa, and I'm just going to give you a very rough idea. No, you didn't miss the poster. That's I'll show that at the end. But I'm going to use the My Health Sherpa just to kind of show you what I'm talking about. I know not every state has $0 deductible plans, but in case you do, you'll understand why I'm picking that one. So I'm just picking a local carrier or local zip code. Our average age is around 60 and household income is 30,000. This person's retired and they're getting a cost sharing reduction. So I scroll down here and I'm going to move fast because I'm really familiar with this. And I see the silver plan. And then I know they want Aurora, which is my network. I know these plans very well. I'm going to find the $0 or the $0 deductible plan. And I start comparing them and I start showing them side by side. All right, sir or ma'am, it's gonna be $70 or $0. the difference. I explained to them the difference between the $0 deductible and a $3,450. If this was a $5,000 deductible, this would clearly be the better plan, but it's not necessarily. Or what the difference is between 7,000 and 9,000 out of pocket. If you do not understand deductible and max out of pockets very well, how are you going to tell them? So make sure you go in there. I even have on my YouTube channel, Next Step Insurance, I just really brief things about deductibles and max out of pockets. Learn that so that you know it. If you don't know it, your client's not going to know it. Then I'll come down here and I'll show them copays, $55, $15, $90 specialist, $200 specialist. Walk them through, see what that is. If they never go to the doctor, they don't care necessarily about the $200. But if they go to the doctor every 3 weeks, 90, even if they're paying 70, is better than 200. So just let them, walk them through. And they kind of like this price point, right? I mean, who doesn't like zero? And they're maybe leaning towards this, but they keep talking about this max out of pocket. Well, they're telling you what their pain point is. They're telling you that if they have a $9,000 out of pocket, they cannot afford it. So then I say, I have a solution for you. I have a hospital indemnity plan. That would make it the best plan ever. Heck, they'll pay for most of these copays. Or I have an accident policy. You're young, you go biking in the mountains. All right, you know what? Let's get you an accident policy so that if you have this ER visit and it is an $1,800 copay, that accident coverage is paying your $1,800. Well, I'm not really accident prone. I'm more worried about the hospital stay. Okay, let's get this $1,500 per day. Or if they're in this plan, let's get your 7,000, your 9,000 covered. Because if you're in the hospital for a week, your bill is going to be 9,000. If you're in the hospital for a day, it's going to be 7,250. Let them tell you what their pain point is. Don't tell them, hey, you don't go to the doctor and you're saving yourself $70 a month. Okay, you're telling them that their pain isn't worth acknowledging. But the truth is, they're the ones who are going to have to pay that. Well, what if I get cancer? Well, I have a solution for that. This insurance is going to help cover you, but let's get you a cancer policy that will help you pay out of pocket so that you can do what you want. Listen to what they're telling you. Now, there are a million carriers out there that will sell indemnity plans and critical accident, and you can get contracted with all of them if you want. You can dig in deep dive into each details and find the nuances. But I would start simple. There are carriers that will have most of them. I will mention United Healthcare. Okay, United Healthcare has an accident, has dental, has vision, has hospital indemnity. It has pretty much everything you want in one spot. So you don't have to search here, and try and find the best. They even have guaranteed issue. So I'm talking to somebody who's like, well, I have a heart attack 4 years ago, and I know what it's like to spend $9,000. Well, I have a guaranteed issue option for you with United. I'm really healthy. I never go to the doctor. Well, we can get you one that's underwritten, which will be less expensive. You can then go into other ones. There's Philadelphia, there's Manhattan, there's NatGen. If you're already contracted with these ones, that's great. Pick the one that you like. I'm not going to tell you who you have to use, but each of those carriers will help you fill this gap in. And if you want to keep it simple, find the carrier that has all of them so that the client only has to pay 2 bills. One to the marketplace and one to whoever you've layered it with. You have to they're coming to you because they're saying, help me. They're asking, in this company or in this business, we really don't have to sell them. Yes, you have to get them to come to you to know that you're the expert in insurance, but you don't have to give them a hard sell. They want you to sell them something. They want you to give them insurance. They want you to show them where the holes are, how to fill that gap. I host a webinar or in-person class at least 3 or 4 times a year that says, don't let insurance stop you from retiring. And I talk about the marketplace and tax credits and how all of that stuff works. But then I talk about the layers: accident, gap, indemnity plans, dental, vision. And every time somebody goes, how come my agent didn't tell me about that accident policy? How come my agent didn't tell me about critical illness? How come my agent didn't? And I'm like, maybe they didn't know. We all know these products exist. Don't shortchange yourself because you're afraid that they're going to say no. Assume they're going to say yes. I created a form. I just did this for myself many years ago because I am one of those people who will search 14 different companies to try and find the cheapest, best one. And then I would layer them and I'd show them like every single one. And then they, of course, would leave my office going, this is great, protected. And then 3 weeks later go, what did I buy? There's $20 that's coming out every month. What is that? So I will show it to you. You can make something like this. Or if you want mine, I can send it to you. It's a way of totaling all of the products that they're getting and what they are. So this is my PDF that I created. Here's my logo, your insurance information. I type the person's name in here, Mr. Smith or Bobby or whoever, the primary insurance carrier. Now, maybe this is a short-term carrier. Maybe it's the ACA carrier or you went direct. So I just list the carrier here. United Healthcare. And on the marketplace, it's going to cost them, I don't know, $120. And then the secondary insurance, it could be an indemnity plan. It could be a gap. Accident protection, hey, that's around $35. Critical heart attack, stroke, I write $30,000 coverage. And then depending on who that is, I'm just saying 45. I have a spot here. I choose not to buy critical illness. If they're not going to do it and they don't have it, I want them to be aware how serious that is. I have them sign a date. They only want dental. All right, I'm going to give them Delta. I don't know. Delta Dental. And they got the really big plan. It's $56 a month because I don't know. They got a mouthful of crowns to do, whatever. Maybe it's a combo plan. I put this down here to talk about life insurance. I'm not necessarily going to do a life insurance quote and everything at the same time, but it's there. So then they see the total. It's calculating right here at the bottom. Every client you talk to has this dollar amount in their head before they walk into your office. And I will tell you, a lot of them are thinking COBRA rates, especially if they're coming from an employer plan. They're going, my COBRA is $1,000 a month. Whew, I hope I can find something less than that. That's what they're thinking as they walk into your office. And you show them this, you layer all this stuff, and I'm going to put an indemnity plan, which they're 150. I come down here and it's 406, and they are like, oh, this person's saving me $600 a month from what I thought I was going to have to pay. Excellent. Now, I do know this is a lot. You may not be ready to do all of these. Start asking every single person if they want dental. Start asking every person about accident protection. Accident is fairly inexpensive. And unless they're in a gold plan, somewhere, if they go to the ER, they're going to pay the deductible. They're going to pay a high copay. They're going to pay the max out of pocket, depending on how that is. So this is absolutely easy to sell. I will talk. So here's this dollar amount, it's $406. If I've got this side by side, I do typically throw a gold plan on here. I let the client talk me out of a gold plan because they think, ooh, gold, what's that going to look like? So I picked the lowest deductible or max out of pocket is $3,000 in my area. So I throw that on there and I go, okay, you could do 0, you could do 70 or $396. You still have a $3,000 deductible and max out of pocket. This is a great plan. And they may be fine with that. Or I show them this and it's only $406. It's not much more than what I was having on the copay with that gold plan. And they're getting dental with it. They're getting critical illness with it. They're getting coverage so that when they have to use even the $3,000, they wouldn't have to. So those ones to me it's pretty easy to sell. So Brian, you have a question. I have seen sickness and then cancer, heart attack, stroke. Why are these separate? Isn't cancer the same as sickness? So cancer is one that they pull out separately. I typically do a combined one, critical illness. Critical illness will include cancer, heart attack, stroke. Every carrier will have extra ones. I saw one that had Legionnaire's disease. I didn't even know that was a thing we had to worry about, but hey, if you got it with that critical illness policy, your Legionnaire's would be covered. So look at what the details are. Sometimes sickness, it does have cancer. So you just have to see what it says because it will list very, very detailed. This is what I cover and this is what I don't cover. I'm going to attach my form that I just was showing you. It does have my stuff on it, but you can create your own, or you can, if you have Adobe editing, I highly recommend everybody get the Adobe editing software. It's worth every penny so that you can edit Adobe forms. You can create this, it's called Adobe Acrobat Pro. That's what you want to buy. You can then edit. You just come over here, hit edit, take my logo out, put your logo in. You know, these were my colors. I liked them. Change your colors. This is pretty self-explanatory. And then I print this off to everybody when they leave. And when they leave my office, they now remember exactly what they got and who it's going to. And yes, United Healthcare has guaranteed issue plans. They, in fact, I think Bobby Joe is on here. She is a great representative of United Healthcare, knows their plans ins and outs. If you want to know more, because I will say one of my, you log on to United Healthcare and the short term is at the top, and then they have a bazillion options. It's like, wow, I think Vision's the one that only gives you 2, but there's like 5 dental and there's 27 of these things. Yes, if you find the GI, it's listed at the end. Those are the guaranteed. So now even those who have been sick can get it. They have a great one that I personally like. We were just looking at this last week that has a guaranteed accident and it just comes with a critical illness on there, either a 5,000 or 7,500. And it was not like crazy expensive. It really wasn't. There are even some ones that are on there that are less expensive for those who qualify for CSRs. Sometimes there's a difference. Those who qualify for CSRs because they were very smart with their money. They're pulling out of a Roth IRA. They've got lots in their savings. And then there's the one who qualifies for a CSR who's living Social Security check to Social Security check. They do have, one of the things I really liked about United Healthcare is they've got some plans that are only a couple bucks more. I mean, they're very inexpensive, that just cover hospital, that just cover accident, that way somebody who's only making 20,000, and they end up in the hospital with the silver plan, even though they're in the CSR, 3,005, oops, yeah, that's the wrong, no one's going to pay that much, lowest premium. They may be in this policy and they're looking at 2,700 and they're like, I can't afford, that's going to be a real big stretch. I scroll down here. Well, what about 17? I can do 17. It's only going to cost them $8, but even 1,700 is a stretch. Well, can you afford 20 bucks a month so that if you end up in the hospital, 100% of that 1,700 is covered? Yes, I can afford that. So don't be afraid to offer it to them because you don't know what's important. Some would rather pay $30 a month and not have to pay 17. Bobby Joe's just stuck a thing in there. So if you are curious, interested, if you're not currently contracted with United Healthcare, absolutely you should. But she's great at explaining the products because there's a lot. And sometimes just digging through all those products can get a little confusing. Like I said, find the carrier you like, pick your plan. I got one carrier, I love their accident policy. All right, use that one. It doesn't matter. What matters is that your client is protected. I will tell you, most people would rather pay one carrier, one premium a month than 12 carriers and save themselves $20. Right? I mean, like I worked all this hard and I found you 12 different carriers and it's really a savings of 20 bucks. And then they're like, 4 years later, they're like, I don't know what I'm paying. They would rather pay one. So you will have some who will want the nickel and dime, but most people don't. They just want to come in, hear you tell them how to protect themselves, explain this crazy insurance to them. And if somebody's making 60,000, You know, they don't get a CSR at all. The bronze plans and silver plans. So here's that gold plan. Is over $583. If somebody asks you, if you show them the bronze, you show them in the silver, and they ask to see the gold, they want other coverage. They want to not pay money when they go to the doctor. I can tell you right now, because that's what they're looking at. They would rather pay more per month to not go to the doctor. So then I show them this at $406 a month, and it's better than the gold plan because it's going to protect them from that out of pocket. So then I say, hey, well, I can get you something better than this gold. It's going to cover you more and it's going to get you dental. And they're like, okay. So then I say, let's do this bronze plan with the $0 deductible, $336. And then we can layer these options. Let them pick. Don't be afraid to put it up there. You don't have to hard sell. I don't like, if somebody asks me what's your budget. Yeah, no, don't ask them their budget. They already know their budget. Don't assume you know their budget. They know it. Just show them this. And they may go, oh, you know what? My mom bought me a critical illness policy back when I was 12. It cost me $12. Or I have it from my group. Okay, I'll take it off. There you go. Instantly removed. Well, I need some vision. All right, I got a great policy. It's $10. They see it live right there. And you print this off, you hand it to everybody as they walk away. It's very clear that they purchased it, what it is they're getting, and it's already set up. Does anyone else have any questions?
Chris, I'll just make a really quick comment. Thank you so much for that. I absolutely love that spreadsheet that you share with them, because you are then showing them that you are going to well round them in protection. The biggest thing that we see happening is that clients are underinsured. And it is a broker's responsibility to do their due diligence and properly insure a client. If you're putting somebody in 9,100 out of pocket and they can't afford that, that's not properly insuring them. So when you do that and you have that all spelled out for them, they can clearly see how well rounded their protection is going to be. And like you said, many times putting all of these things together can be cheaper than, say, that the gold plan or a higher end silver plan. So I love that spreadsheet. That's very great.
And I will tell you, you make a good living. And I don't do, I never did it for that reason. When I started layering, I had to do it because I couldn't get people major medical coverage. And so I had to find a way to protect them absolutely, no matter what happened, that they would be covered, because there was no ceiling, there was no cap. So I had to layer it just to give them what they really needed. And I was absolutely floored at how much I made. And so in my office the other day with one of my agents, I said, all right, you sell an accident policy, it's $35. You sell dental, it's $35. And let's just put a critical illness policy, real small one, $35. And we did very rough math. For 50 people, he would make an extra $15,000, just like that. And he's already got almost 300 clients. So if he had done that with 50 people, he would have made an extra 15,000 on top of that. So it really is, it's not hard. If you don't ask, they're not gonna, they don't walk in going, hey, you got that accident policy? Hey, I think I might have cancer next year, so could you give me a critical illness policy? But you know full well, every one of you know that when somebody gets diagnosed with cancer, when you can say, hey, that $30,000, would that help? They're all gonna say yes. So find one, just find one of these products that you can believe in and start offering, just do it every single time. It's just on there. It's part of your presentation. And I'm going to show you very quickly a couple of things and my poster, and then we'll head off and, meet again next week. So I don't know, some of you saw this video, but I've talked about the conference that's in Fresno. So this is How about those Cowboys? You don't have to be a Cowboys fan to come. But if you are interested in the conference, this is the website again, na-insurance.com is the agent conference. I'll stick that in the chat for those who are interested. And the video is going to be on there. Hard to hear because I don't know what it is with Zoom. It doesn't like that, but that's why there's closed captioning. The tickets are very affordable. I learned so much every time I go. I've been to 4 of them now, and it's really, really good. So Rosalind, you asked how lenient is the underwriting for GAP plans, diabetics. It'll say that right on there. If they don't qualify for one, you got the guaranteed issue. So I like United Healthcare for ancillary products. Like I said, they're all right there. It's easy. I'm actually contracted with a lot. I use Manhattan, I use Philadelphia American Life, I've used NatGen. I just said United's the easiest one because everything's kind of there. So absolutely, I will say this, and Bobby Joe knows, I was like, they're the biggest conglomerate in the world, but their side, this United Health one, basically think of them as their own entity. I never have problems with claims. I don't ever have issues where a client's like, I didn't get it. So I have to say with that, you know, if they're underwritten and they're in it, they got it. And that part is kind of nice, as opposed to later going, I hope my client gets what they need. You know, that part is pretty big. So, and yes, if you know, SureBridge has a guaranteed issue. The guaranteed issues are nice because before I could never do it, right? Somebody's already sick and I just was like, I'm sorry. I got nothing for you. And yet here's these guaranteed issues. And they're the ones who know. People who are already sick, a husband and wife, one is sick, one isn't, you're going to be able to sell it because they already know what that means. They already know that when major medical things happen to them, how much it costs them. And then let me see if I can find my poster really quick. Thought I was going to have it up and then I didn't. Let me stop share so I can look really quick. It's nothing major. I mean, it is very simplistic. I have to make it small enough so you could actually see what it looks like on an actual poster. So here's my poster right there. Now in my state, it's called Badger Care, but I was told that those over 65 know it as Forward Health. So I stuck the whole thing, losing Badger Care, Forward Health. Put my number and just said we are a free resource because I think resource sounds better. Resource to find affordable health insurance and Medicare options. We have many plans with $0 deductibles, affordable premiums. And then for us, because I'm very proud of this, we were voted the #1 insurance agency in Sheboygan County. You can say I've been working with the marketplace since 2023. I don't know, whatever you want to say. It doesn't have to be big, just a simple poster, losing insurance, losing your coverage. We are going to be working with North American to get this on their shop, the product shop. I don't know if you guys, I've shared this before. North American Life Plans has a shop, resources, and right here's the shop. Allstate products, under 65, retractable banners, and the poster will be on here soon. All you would have to do is tell him, here's my logo, the printer, the printer. So here's that shop website again. Same with anything else though. I mean, if you want the rack cards, which I think are great, you can walk around with a shirt saying, ask me about Medicare if you want. There's lots of marketing products. It's simple. It's already done. It's been vetted by marketing people, by healthcare.gov. You can get magnets. You don't have to do anything, just your logo, your name, and your colors. Any quick questions? I know, Brian, you sent me some, and I will actually be answering those next week. If you've got anything through the rest of this week, next week is kind of our last focus on Medicaid rolling out. There will continue to be a weekly call. They will have a specific topic. So like one might just be CSRs. One topic might be married but separated, right? Legally, they're still technically married, but they live legally separated. What does that mean? How do I do children that are not in this state of the parent? And, so every week we're going to have a little bit of just a quick 30 minutes on a specific topic. So that will continue, but next week's kind of the last one for the Medicaid. And like I said, Brian, I will answer those questions next week. This one though is more about layering. Thank you very much, guys. I know I went over. Be respectful of your time. Shoot me an email if you need anything else. I am happy to help send you any documents that you need. Insurance.com. My email's in the form, and then the recordings will be on later on the YouTube on Facebook. Thank you very much, guys. Have a great rest of the day.